How do you understand conflicting autism terminology? Imagine trying to solve a puzzle where some pieces look different but actually fit together. That's what understanding autism terminology can sometimes feel like. First, let's look at what autism spectrum disorder really means. It's a broad term for a range of neurodevelopmental conditions that affect how people communicate, socialize, and behave. It covers many different experiences, which is why it's called a spectrum. In the past, there were separate terms like autistic disorder, Asperger's syndrome, and pervasive developmental disorder not otherwise specified. These were used to describe different types of autism. But now, the official diagnosis in the United States is simply Autism Spectrum Disorder. This change helps doctors and families understand that autism is one continuous spectrum, not separate categories. The current way to diagnose autism is through the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It looks at how much support someone needs in two main areas: social communication and repetitive behaviors. Support levels are divided into 3 categories. Level 1 means some support is needed, Level 2 means substantial support, and Level 3 means very substantial support. Another word you might hear is neurodivergent. This term describes people whose brains process information differently from what's typical. It includes autism, attention deficit hyperactivity disorder, dyslexia, and dyspraxia. It's a neutral way to talk about differences in how brains work, without labeling them as good or bad. Understanding these terms is helpful because it guides how we support and communicate with people. For example, therapies like applied behavior analysis use specific language to help improve behaviors and communication tailored to each person. Sometimes, conflicts happen because people still use older terms out of familiarity or personal choice. It's okay to respect that. But it's also important to use current terminology when talking about diagnoses or seeking support. From the perspective of someone with autism, understanding these words is about recognizing that everyone's experience is unique. It's about respecting individual strengths and challenges. Using respectful and accurate language helps create a more inclusive environment for all. So, when you hear different terms, remember they're all part of a bigger picture. They help us better understand and support each person on the autism spectrum. It's about seeing the person first and understanding their journey.